Good day, everyone. Have you ever heard of Bell's palsy? Perhaps you may have heard some celebrities who had it. Do you know the causes or the symptoms or even the treatment that they get to cure it? If not, then in this video you will get to know more about Bell's palsy. Introduction. Bell's palsy, also known as idiopathic facial palsy, is a neurological condition of temporary facial paralysis or weakness on one side of the face. However, in rare cases, it can affect both sides. The condition causes one side of your face to droop or become stiff. In most cases, Bell's palsy is temporary and symptoms usually go away after a few weeks. Bell's palsy is named after the Scottish anatomist Charles Bell, who was the first to describe the condition. Example real case. This is Faye Kussairi, a local Malaysian actress, documenting her experience with Bell's palsy on Instagram to raise awareness on the condition. She was diagnosed with Bell's palsy when she was 38 weeks pregnant on December 2020. On her Instagram, she said that the right side of her face suddenly became paralyzed when she was brushing her teeth. She sought the help of neurologists and was advised to do facial exercises such as practicing opening and closing her eyes. International celebrities who had Bell's palsy include Angelina Jolie, Katie Holmes, Sylvester Stallone, and Pierce Brosnan.
Causes of Bell's palsy. Bell's palsy occurs when the seventh cranial nerve becomes swollen or compressed, and inflammation resulting in facial weakness or paralysis. The facial nerve controls most of the muscle in the face and parts of the ear. The facial nerve goes through a narrow gap of bone from the brain to the face. If the facial nerve is inflamed, it will press against the cheekbone or may pinch in the narrow gap. This can result in damage to the protective covering of the nerve. If the protective covering of the nerve becomes damaged, the signals that travel from the brain to the muscles in the face may not be transmitted properly, which leading to weakened or paralyzed facial muscles. The exact cause of this damage is unknown. However, many medical researchers believe it is most likely triggered by a viral infection. These are several viral infections that may trigger Bell's palsy. The most common types is herpes simplex virus, which can cause demyelination, which is damage of myelin. The other viral infections are herpes zoster virus, Epstein-Barr virus, Lyme disease, sarcoidosis, and lastly HIV. The risk of developing Bell's palsy increases if you are pregnant, have diabetes, have upper respiratory disease, and have migraine.
Signs and symptoms. For the signs, it can develop 1 or 2 weeks after having a cold, ear infection, or eye infection. It usually appears abruptly, which is sudden and unexpected, as you may notice them when you wake up in the morning or when you try to eat or drink. The symptoms can be similar to other serious conditions such as stroke or brain tumor, and what makes them different is that Bell's palsy only involves facial nerve. Symptoms: inability to make facial expression such as smiling or frowning or closing the eyes, drooling due to weak muscles around the mouth, difficulty in drinking and eating, headache, irritation of the eye on the affected side. Next, hearing in ears, which is a condition called tinnitus, mild weakness to total paralysis on one side of face, changes in the amount of tears and saliva being produced, and difficulty in talking.
You might be wondering, what is the treatment that the Bell's palsy patient will get? Now, we will talk about Bell's palsy treatment. The treatment for the Bell's palsy can be divided into two, which is medication and also home treatment. In most cases, Bell's palsy patient does improve without any treatment, but it takes several weeks or months for the facial muscle to gain its normal strength. First, we will talk about medication. The medication that will be taken by the patient is corticosteroid drugs such as prednisone, which function to reduce inflammation of the facial nerve that occurs. This can make the nerve function normally back. It is best to take these drugs early within several days. Since the symptoms start, antiviral medication will also be prescribed to the patient, such as valacyclovir, which is Valtrex, or acyclovir, which is Zovirax. If the Bell's palsy occurs due to the viral infection, this medication can also be taken along with the steroid that helps to restore the facial nerve function. Other than that, over-the-counter pain medication such as aspirin, ibuprofen or acetaminophen can also be taken to relieve the mild pain that occurs due to the Bell's palsy. Bell's palsy usually will affect the patient's eyes for its ability to blink and close the eyes that can make their eyes become dry. To prevent the eyes becomes dry, eye drop or ointment can be used to keep the eyes moist. Now we will talk about the home treatment. Other than eye drop or ointment, eye patch can also be used for the dry eyes in order to keep their eyes from dirt and dust, and to moisten. A warm and moist towel can be placed at any place that feels pain to relieve the pain. Facial massage and physical therapy exercise can stimulate their facial muscle to function normally. We have come to the end of this video and we hope you can gain some knowledge from this video. That's all from us. Thank you.